So, hi, everybody. Dr. Greg Barsten here. I'm a chiropractor and a clinical nutritionist in Los Gatos, California. And today I have Marcus Freudenmann here, who has been so kind to lend his time to do a brief Q&A with me on something that's near and dear to my heart, which is ozone. Marcus is the founder and developer of the Truly Heal Academy and what I call education and learning platform. And Marcus, thanks for sharing some time and lending your expertise on the vital subject of ozone.
Well, thanks for having me.
Yeah. So if I can jump right into it, I want to ask you a question that I know is probably on everybody's minds when they hear the word ozone, because they typically associate it with negative aspects like the ozone layer depletion or with smog and pollution, that it's a bad thing. You need to be inside and indoors and things like that. But yet many respected doctors all over the world claim that ozone can have some very positive healing effects into there. So why is the confusion? Can you clarify that a bit? And how would you address that?
Well, you could address that in two forms. One would be it's a very cheap treatment. One oxygen bottle, which costs you probably $100, lasts for 1,000 to 2,000 treatments, and the device itself is very affordable, lasts you for 250,000 treatments if you calculate how many operating hours you can use the device, which means
Wow.
The only person that earns money with ozone treatments is the doctor and no pharmaceutical company. So it's more or less doctors are banned to use it. Even though there is over 7,000 research studies, there is incredible evidence, documented evidence. It's a standard treatment in Germany, Austria, Switzerland, Denmark, Poland. It's very comprehensively studied in Russia. So there is thousands of research studies. And when you see the results, how phenomenal they are, it's pretty evident that the pharmaceuticals want to suppress that. I guess that's number one reason. The secondary is that mispropaganda can be done very, very easily. And connecting, yes, we have ozone layer problems. And when the ozone layer, which is just, 5 millimeters or 2 millimeters thick, if that breaks, the radiation from the sun comes through and causes harm. But they don't really talk about the main causes of that. When you deforestate the planet Earth, as we have, you lose out on a lot of rain and thunderclouds and storms and all of that, which is the main cause for the Earth to produce ozone. So when you have a thunderstorm and you have lightning, the electrical discharge in the clouds splits from O2 molecules, splits that in half and creates singlet oxygen molecules. And those singlet oxygens are very unstable. They quiver. They can't stay on their own. So they attach either back together, which is a small percentage, or they attach to the next nearest O2. So we have all of a sudden O3. And that is a volatile situation which doesn't last very long. As soon as these O3 molecules get in touch with bacteria, fungi, mold, any kind of living entity that doesn't have a protective enzyme shield, they kill it. So it's actually the natural way of our Earth to cleanse and to clean the air and to reduce algae growth, to oxygenate the area. And that's what we have when we have forestation. But deforestation reduces that, and that's why the ozone layer gets thinner and thinner, plus pollution on top. So it's misinformation and emitting very important parts that it's actually a very healthy and very helpful entity that we need.
Well, and that explains why I've heard that why the air smells so good and clean and fresh after a thunderstorm and lightning and things like that is because of the ozone, I would assume, and then, yeah.
And it's highly energized. When you think about, we talk about after a thunderstorm, we take up ions, and the main form of energy supply into the body, which we use with PMF, which we use with light energy, it's ions that are used and that the body recharges with. And when you have a thunderstorm, you have highly energized oxygen that you breathe in, and that just gives us that extra power.
Well, that's amazing. I mean, it seems something that's so basic and fundamental to nature should be viewed as positive across the board for everybody, but yet there's still this miscommunication or misunderstandings, as you're saying, in through there. So I've heard there's other ways to administer ozone in a therapeutic setting. I heard that IV is a very powerful way to administer ozone, but many people can't either afford IVs, or they're needle phobic, or there's transportation issues that can't come around, or it's very expensive. And usually here in the U.S., it's about $100 minimum to $150 per session. Some people, depending on what they got going on, might need 20, 30 or more sessions ongoing. And that's not necessarily that practical. But, I've heard that there's some other ways to administer ozone that can potentially also show very powerful therapeutic effects. What are some of the ways that you think would be the best?
Well, ozone can be applied, and I just had an interview with Dr. Emilia in Cuba, and she was really nice. She said, it doesn't matter how we get ozone into the body as long as we do. And all mucus-associated lymphatic tissue, which means your mucous membranes in your nasal cavity, in your ear, in your tonsils, in your mouth, down the throat, all your gut and all your colon are mucous membranes. And when we understand mucous membrane, it's actually a layer that keeps the outside world outside and allows the inside to be sterile. Your blood should be sterile. Now, if we eat something, it goes through that whole channel through, and we still absorb nutrients, minerals, vitamins, everything into the body, but bacteria and undigested food should stay outside. And that's the job of this mucus-associated lymphatic tissue. So as soon as we start using ozone, we repair that. It actually heals tight junctions. It repairs that whole system in our body and keeps the outside world outside and allows the inside world to be sterile. And that's why using it in form of drinking, ozone water that you drink, you wash out your mouth, you really gurgle and go back to your tonsils as far as you can if you have tonsillitis, if you have any kind of infectious disease. Beautiful. You drink it, it kills Helicobacter pylori, it kills all the Klebsiella, Pseudomonas, all the different bacteria, pathogenic bacteria, just by drinking ozone water. So that's number one. Then you can do nasal treatments where you blow up ozone into your nasal area, and that starts a massive die-off of bacteria. You have all the bacteria, the snot, old stuff, very old stuff. In some cases, it's very disgusting what comes out of your sinusitis. And once that happens, it clears up, it heals the mucous membrane, oxygen is imported, your immune system works better, and the same, you blow it into your ear. And what the Cuba study has shown, 3 autohemotherapies, which is the major autohemotherapy. They take blood, they take it out, they swill it in a container with ozone, and then they drip it back in. 3 of those is compensated with 5 rectal insufflations. And they have a Cuba protocol, they have the Swiss protocol, the German protocol, the Schumann protocol. There's many different protocols. They are all very similar, very, very much alike. But they show that when you do 5 rectal insufflations, you compensate for 3 needle prone. And have you seen the needles that you need to do for autohemotherapy?
They're big.
They're scary. And so for children, that's not possible. For elderly people, it's not possible. People who had a lot of vitamin C or other infusions, who had chemotherapy, they have destroyed veins. You can't do that treatment. And that's where rectal insufflation is probably the most easiest and most convenient way to do it.
And this can be done at home.
Yeah. Well, we have now over 1,000 patients or 1,200 patients that do rectal insufflations at home on a regular basis. And the protocol is outlined really 5 days a week. And then you have 2 days off. And you do that for a period of 4 weeks. Then you have 2 weeks off. And it really is 5 days, 2 days off, 5 days. So for a span of 4 weeks, 2 weeks off, and then you start from the beginning again. And it really guides you through immune modulation, immune stimulation, immune activation, and it modulates different forms of your immune system. So it's phenomenal for healing wounds, for blood pliability, for building up immunity. It's not a fast treatment. A lot of people expect, doctor, pill, and pain is gone. Ozone is a very gradual process. It stimulates your immune system in sequential factors. But after 4 weeks, you have results that are lasting instead of having a short, quick fix, but then the disease comes back in another way.
What type of conditions have you seen and experienced with or heard from other doctors and clinics around the world that have had really good success with using like rectal ozone?
The main, let's just say any form of ozone, if it's rectal or autohemotherapy, is a systemic treatment. So it always works on your whole system. If you combine it, for example, with external bagging or external oil or external wound washing, then the most researched and where you have thousands of research studies is wound healing. So if you had radiation burns, burn wounds, diabetic neuropathy, ulcers, pressure ulcers, those cracked heels, any wound that is infected and doesn't heal within 4 weeks, sometimes, there's studies when you see those images, how people started out and after 30 days, their hand is completely healed up, or their foot, diabetic neuropathy, which normal medicine can only cut the toe, or cut the feet or amputate. They have no other solution. And here you do a repair job in 2 months and the complete system works. So wound healing is number one. Secondary, it's used as a cancer treatment worldwide, as not to kill the cancer, but to support the immune system and the patient to do the job. And then thirdly, it's used for hormone balancing. And the biggest research studies that I just discovered about half a year ago was in Germany. They use it with children with leaky gut. So wow. When you look at hospitals that have a lot of children with autism, with celiac disease, with ADHD, it's all related to the gut. And what they do is they realize that when you heal the gut with ozone water and ozone insufflations, it repairs tight junctions. It regrows the villi. It actually recreates a healthy mucous membrane. And through that, all of those diseases go backwards. So that's phenomenal. And the results that those clinics could provide is fantastic.
Wow, that's amazing. And I know, and I know it's a very, very simple process to do at home. Some people would say, oh, enemas, it's like, no, it's ABCs. It's very, very simple. Would you agree?
My children do it.
Yeah.
We have, and the funny thing is, I always say education makes the change. Now, my children do it, and they use it for pimples. They use it for everything. They repair the gut if they have allergies. And they talk to other friends. Now, we have a lot of other friends now who do the treatment as well, because it's really simple, it's fast, and the efficiency is so visual. I had a client come recently. He had severe acne in his face, like a lot of problems. And it's always the gut. So he started to do the gut treatment with rectal insufflation and ozone water. And within 2 weeks, his skin cleared up, inflammation was gone, all his pimples vanished. He looked really like a complete transformed person. And he's just taken it out now to a whole community. It's just self-evident. You don't need to convince anyone. If you see it, it's phenomenal.
Yeah, I know one of the things that we keep getting feedback with of what an amazing purifier it is for the cells in the blood and the lymphatics. And so here's a question that comes up a lot. I get this often, or patients will bring things up. Well, what about this? How does it compare? How would you compare ozone in terms of either oxidative or oxygenation-based therapies compared to hyperbaric oxygen, like hyperbaric tanks?
Both increase the oxygen uptake, which your immune system needs to kill pathogens, cancer cells, everything. So oxygen is the main result. And they go on par. I have 3 studies that show that it's on par with hyperbaric oxygen. So it's equally efficient and effective. Ozone has one additional factor, that it kills off pathogens on contact. So when you go and have an infected open wound and you would go into a hyperbaric oxygen chamber, it's still your body that needs to do the work. With ozone bagging, for example, when you use an ozone bag, and you oxygenate and ozonate that area, it kills off all the bacteria, it kills off the pathogens, and the wound healing process is probably expedited by factor 3. Internally, in regards to gut healing, for leaky gut, it's the same factor. Oxygen, like hyperbaric oxygen, wouldn't have a big effect on that. Whereas rectal colon cancer and all of that, they respond directly to it. And you can find a lot of studies for ulcerative colitis, Crohn's disease, all those high inflammatory diseases that we have in our colon and in our gut, they respond fast, whereas hyperbaric oxygen wouldn't touch that, or very slow and very, very much more gentle.
Yeah. And I know I've seen in the literature that hyperbaric has got a good presence there, but a lot of that stuff comes from things like immediately right after a stroke, and that what they call the golden window, the bends, if somebody's diving, things like that. But it, as you're saying, it doesn't have as strong of that pathogen purging component. And, you know, the elephant in the room to me for a lot of patients when they come in is, you know, it ends up being that rectal ozone systems are significantly cheaper than going to a doctor's office and getting multiple hyperbarics all the time, not to mention the inconvenience of having to schlep around to doc's offices all the time.
Yeah. And like I said before, you get one oxygen bottle from Welding Oxygen, which is 99.5% clean. Medical oxygen is 99.8% clean. So it's 0.3%, which is difference. And it's only the bottle that is better documented with medical than it is with industrial. But it's filled from the same reservoir. It's filled from the same tank. So you have the same quality oxygen, and you can do that at home. And like I said, I have my bottle now for almost a year. We buy it with, I think, 30,000 PSI pressure oxygen, and it's now on 25. So it's, you know, you use that one bottle for an eternity. So best is if you buy a bottle and then use it for the next 2 years, and then the treatment becomes ridiculously cheap, especially if you have a few people or the family using it.
Yeah, I know we've had no problems with ours. I mean, even as a practitioner, but there's most of the people that I see are not practitioners. They're the average patient, and there's no problem at all with obtaining the oxygen of quality grade like that. And they don't kind of grill you. We just tell people, hey, just tell them that you're doing artwork and you're using this to kind of blend chemicals and paints and things like that, or that you're as you mentioned that you're breeding fish and you want to put it in there. So. But we haven't had any problems with that. And I have to say, it's such a very, very simple system. It truly is kind of a no-brainer. So I look at this as one of the ultimate healing tools in through there. And so I guess if they just click on the links here, they can kind of get that and then go through the channels and get educated. And you're so great with all the other YouTube video clips as well.
I think that's it. It really makes a big difference. If I step into a task like that uneducated, it's scary. And there is a lot of rumors, and we're imprinted with the things we've heard. So as you go through, and the nice thing is on that page, we have now 4 buttons. And one would be if you use it for infectious diseases. You know, Lyme's disease, hepatitis C, AIDS, HIV, all of that is a separate channel. So if that's something for people interesting and they are infected with Lyme, they would learn how to do that. They sign up for that funnel. And then it gives them not only how to use the ozone in that area, but also what are associated treatments, what else can I do, how do I reduce my inflammatory process, blah, blah, blah. If somebody has cancer and really focuses on cancer, they don't want to know about infertility problems and vaginal treatments. They want to know how I treat the cancer.
Right.
So we've structured it this time really based on the disease that people have. And that's most appreciated because, let's just face it, one treatment that can be used to correct infertility and also wound healing and also cancer is very confusing and people get lost. And that's why we've separated it into 4 courses. There will be more because we get more and more doctors. I have 16 interviews booked now, and we do an ozone summit. And every doctor is a specialty, has a real focus in one area. And they do, for example, autistic children. And if that's the case, we build that into a protocol really for autism or for ADHD or children on the spectrum. And then it makes it a lot easier for people to find it and also to use it and to translate it into their life. So the educational part is very, very comprehensive. I show them how to screw every tiny little bit together and how to set it up. And as you said, it's super easy.
Well, I love that targeted approach because that's going to strike a resonant chord with a lot of people that have a particular issue or a concern in through there. But I also like that component where they can spread out and say, well, what else can this be good for? I mean, I almost consider the ozone systems and ozone therapy. I'm not going to call it a universal therapy, but it's pretty close to that. I mean, and for something that's found in nature, I mean, it's quite special.
It can't be patented because it's a natural product. But one of the things that you just said, when you go, I've visited probably about 90 clinics worldwide that deal with alternative cancer, alternative chronic diseases, and it's growing because I'm just working on a little documentary on ALS, and that's another one of those problems that we face in our world that is completely uneducated and misguided. And when you look at the concept there, all of those clinics, every single clinic showed me as one of their main treatments to prime the patient, to prime the immune system, to reduce the toxic load, to reduce plastic toxicity, to oxygenate, to balance the immune system, like all of those factors, ozone treatment. And they all have equipment there to do that 3 times, 4 times a week. Now that's self-evident in itself that this is a treatment we have to incorporate to really truly heal. And, that's my main purpose, not just to fix the symptom, but to get to the underlying causes.
Wow, that's amazing. You'd think if it was just 1 or 2 clinics that, oh, well, maybe they're onto something, maybe they're not. But when it's that widely adopted, and for a period of time like this as well, they're onto something in here. So, hey, thanks for doing this interview. I really appreciate that. Is there any final thoughts that you have on ozone that folks can take home that say, well, this is really kind of, something that I should strongly consider from a prevention standpoint, from active management standpoint, from anything else that you can think about that we didn't cover?
Well, I have a lot of sports people that use ozone before they go for Olympics, for example. If they do any extreme sport, if they travel overseas for competitions, they prime their body with ozone before they do it. They just do a 4-week protocol, the Cuba protocol beforehand, which means they build up their immunity, they build up their endurance, their oxygen release is a lot faster into the tissue. So for sports people who want to prevent and want to have higher performance, it's the ideal tool. The Gesund Clinic in Germany hosts for Olympic candidates all the training, and they do ozone treatment, hypothermia treatment, treatments that we offer for cancer patients. They do that for healthy sports people, and they have tremendous results. They're booked out before those events completely, and then they go with an extreme immunity and extreme endurance.
Wow. That is one thing that I've been hearing quite a bit about ozone, the benefits of that. And again, I guess that comes from the upregulation of the different systems in the body, as well as just the high dose of oxygen that's being delivered in through there, which is kind of becoming in short supply. It depends on who you talk to. But so I have one question that just came up. I just thought about this, and I know we used to use ozonators in the past, and have once in a while when someone's putting new paint in a building that are outgassing, they have chemicals, maybe particle board, things like that. When we would say, here's an ozonator, be in there, but we would say, don't try to be in the room at the same time if it's going for hours, because it can be irritating for mucous membranes. But yet you're saying if they're injecting that or insufflating it with a non-needle syringe or a tube in through some of the oral cavities or the nose or the ears. So that seems a little confusing, but my take on that is that's a short-term burst for a very short-term period when you're doing it therapeutically, as opposed to being in a room and sleeping in it for 8 hours. Was that correct, or would you say there's something that needs to be addressed there?
It needs to be a little bit addressed. It's correct in essence. There is every cell that doesn't have an enzymatic protective shield. Like all your normal cells have SOD, superoxidase dismutase, catalase, glutathione peroxidase. They have that as a protective shield. And that means oxygen particles come and they energize that enzyme shield. Your lung cells don't. They don't have that protective shield. So when you breathe in ozone, they respond like bacteria, they die off. And that's why you don't want to breathe in ozone. So when we do a nasal treatment, we do it very simple. We take in a deep breath, fill our lungs so that no air can go in. Then we blow up ozone into the sinus, so we can't breathe it in because our lungs are full. and then we blow it out. As we blow it out, it's already reacted. It killed off bacteria, it activated our immune system. The transition from ozone back into oxygen has happened probably within 30 seconds, so, or even 10 seconds. So when you do treatments in your ear, in your sinus, you don't breathe it into your lungs. You blow it out. The treatments that you talk about to sanitize a room, to kill off mold, or to kill off all the plastic toxicity from paints and all of that, that should be done in a sealed room where you're not in. Run it for 2, 3, 4 hours, high concentration, as high as you can, and then ventilate the room. It has already reacted, so it's not dangerous anymore, but you don't want to breathe that in. So the only organ that doesn't respond well to ozone is, and it's just irritation and inflammation in the first stage, high concentrations, but you should still avoid it.
Okay. Well, that's great. Thanks for clarifying that, because I'm assuming that low concentrations are fine, which is why it's so great in the natural air after a thunderstorm and things like that. Yes. So, yeah, that's why we've always told our patients, if we rent them an ozonator, say, here, go get an ozonator to clean your new house or your new materials out, just don't be in the room with it, because they're breathing that in through the lungs, as you're saying. And you've got such great videos on the links here that we can, people can view and explore further that discuss that in greater detail. So
let me just very short as a final say, there was 5.5 million treatments in Germany alone, just Germany. And they investigated, I think it was 4,700 practitioners that were tested. And they sent in reports about 4,000 or 2,000 patients. And those patients then were treated with those 5 million treatments and 40 incidents. So when you look at the danger rate, if you have Panadol with the side effects, you have 0.01 accident rate, death rate and side effect rate. And ozone, with all of those 5.5 million treatments, had a 0.507. So it's probably the safest treatment, medical treatment on earth. The only thing you need to be aware of, not to breathe it in. And that's easy to avoid. And we teach that in our online classes really well, so that nobody gets into the problem. And we have a destruct unit. If you have excess ozone from bagging, for example, from treating external wounds, you have a destruct unit that breaks it back down into oxygen. So all security, all safety precautions are made.
Wow. Well, that's great. This has been a great interview. Thanks for helping out on this, and I think this is going to be a great primer for people, and hopefully pique some of their curiosity. If they want to look further on through that, then they can certainly do that, and I would highly recommend that as well.
Just press the button below that video or the link below that video, and you'll have the choice to choose which program is most suitable for you, and then you can start all of them or just one of them, depending on what your main concern is.
Fantastic. Easy peasy, as they say.
Exactly.
Right, Marcus, thanks very much for the interview. I appreciate your time as always. It's always great talking with you.
Thank you, Greg. Likewise. I appreciate it as well.